think it's so hard for our seniors to find doctors that they can trust these days? Hello everyone. Thank you so much for joining in today. My name is Victoria Cabrera, Medicare insurance agents in San Antonio with Coverage to Care. And today I'm here with Dr. Rodrigo Cantu with Health Texas Medical Group. And I'm so happy to be here because we work together with the senior community here in San Antonio. And today we want to try to get some questions answered regarding primary care doctors, how some of the stuff works. So today, Dr. Cantu, if that's okay, I'm going to ask you a few questions for the audience, and let's see, if we can answer their questions today. So again, thank you so much for being here. As you might know, I work with hundreds of Medicare beneficiaries in San Antonio, and I help them with their insurance. And naturally, 100% of the time, the question comes up about, well, how is it going to affect my doctor? Or, how do I find a doctor that's going to be good for me? Or all these questions. So I wanted to try to see if we can answer questions for the audience on behalf of the senior community. So before I get into some of the questions, can you tell us a little bit about yourself and what type of patients you primarily help?
All right. Thank you so much for having me today. I really appreciate it. Well, my name is Dr. Rodrigo Cantu, as you mentioned. I'm a family medicine doctor, and primarily I see senior age patients, some younger patients as well, but primarily I focus on senior age patients.
Okay, good. And so you've been in San Antonio for?
A little over 20 years.
Oh, wow. So he's right at our home, everybody. And we're at, the location here is Leon Valley, correct?
Yeah, so I currently practice out of the Health Texas in Leon Valley.
So North Central area. So for those of you guys that have questions, it's a great opportunity to come meet Dr. Cantu. Yeah. So Dr. Cantu, I want to get into some of the questions that, like I said before, I work with a lot of seniors on their insurance on Medicare, but we're always that go-to person that they ask about doctors. And sometimes we can answer so much, but we don't really know every single doctor personally. So I want them to get to know a little bit about how things work and if we can help them answer their questions today. And one of the questions that I do want to ask you is, when we meet with these seniors, they say it's very challenging for them to find a doctor that they can trust. Or maybe they came to us and they say, I don't like my doctor anymore, or he's not taking care of me. I've said all this stuff. So why do you think it's so hard for our seniors to find doctors that they can trust these days?
Yeah, it's a very good question. And I think part of the problem is that medicine has changed dramatically over the last probably 30 or 40 years. In the old days, when I was growing up, my family doctor was, one doctor. He had maybe one partner with him. He owned the practice, and he practiced there from the day he started until the day he died. Oh, wow. And so now most doctors are employed, and so doctors kind of move around a little bit, and so there's a lot more mobility that doctors have in their careers, and so someone might not be with a practice for a long period of time, so we may see a little bit of turnover. And so I've heard from a lot of patients that they started with one doctor, and then they got a different doctor, and or maybe they're always seeing the nurse practitioner because the doctor's not available. Yeah. So there are a lot of factors in that, and the more change you have, the more variability, the harder it is, I think, for patients to put trust in the person that's taking care of them, because it's not always the same person. It constantly changes.
Absolutely. And I do want to stress the fact for people that are listening today, especially the seniors, because they are used to that I hate to say old school way, but they're used to having a doctor. They've established a doctor, and now, like you said, things are changing. But I also do want to let them know that when you work with the primary care doctor, there's a team of people helping you, not just the doctor, but the nurse practitioner, the physician's assistant. So it's not necessarily a bad thing when you see these individuals. Now, if you're never seeing the doctor, that's a different story, right?
Right, exactly.
Right? He's not on the golf course or out on the vacation 10 times a year. But I mean, that's okay too. But what what I want to point out is that you guys work as a team, and that's important because, you know, if they need care, they have a team of people helping them. And from what I know with Help Texas, that's how you guys work too. You guys work really well as a team to provide our seniors with the best care.
Yeah, and that's what we do here. All of the Health Texas offices, ours included here in Leon Valley, we do have physician assistants that work with us, and we work as a team. So the doctor is the primary person who's involved in the care for the patient, but if the patient's doing well and they're coming in just for kind of maintenance of their medical conditions, then we'll have them see the nurse practitioner or the PA, so that frees us up as the physicians to take care of people that are sick or are not doing as well. And we sort of share back and forth, so as a team together, we can actually care for more people.
How would you tell somebody out there that's listening, if they haven't seen their doctor in 6 months, is that necessarily a good thing? I mean, maybe they're the type of patient that's in the doctor's office one time a month, and they haven't seen the doctor for 6 months. Is that a good thing? Because I hear that quite often.
Well, no, it's not a good thing. It depends on how sick that person is. If we have someone who is truly very generally healthy, really doesn't have any chronic medical conditions, they really don't take any medicines at all, we can see that person probably twice a year, and that would be appropriate. But most seniors don't have, that they're not that fortunate. They have medical problems, whether it be diabetes or high blood pressure or high cholesterol, and those conditions require treatment with medication long term. And so checking in even every 2 or 3 months is a lot better, so we can stay on top of their medical problems and prevent any complications before they get out of control.
Gotcha. That's some great advice, because like I said, we meet with a lot of seniors, and it's just sometimes we just don't know what to tell them. We can tell them as much as we know, but it's always good to hear from the primary care doctor personally, so that way you guys know how it works. Dr. Cantu, if you can give the seniors out there that are watching 3 tips on how to determine or find a primary care doctor that they would be a good fit for, what would be 3 good tips that you can give them right now that they can take this away, and if they're looking for a new doctor, they can probably help them in this search for their primary care doctor?
Yeah, and that's really good, and I get that question a lot, because it's hard to just pick a name out of a book.
Yeah.
And so the first thing I think that's important is most primary care doctors are either specialized in family medicine or internal medicine. And the first thing you want to make sure of is that your doctor is board certified. That's really important, because being board certified means that you've had extra training, and you've passed a national test that says you've met the requirements to be a specialist in that area. And even though primary care doctors are kind of generalists, we still have a specialty in I have a specialty in family medicine, and others may have a specialty in internal medicine. But board certification is important. And so I think that'd be number 1 that I would recommend for
write that down.
The second thing I would say is make sure your doctor is someone that has experience in treating your medical conditions. So you want to, if you have diabetes or emphysema or whatever the condition may be, ask your doctor, are you someone that has experience taking care of these conditions? Are you someone that's going to be able to take care of me in your office, or am I going to be sent to specialists to take care of all of my problems, and really the primary doesn't do a whole lot besides managing the specialists, because it is better, I think, for patients to have their primary management of their problems by their primary doctor. And then the third thing I would ask, and this is really important, is ask how long does it typically take for me to get an appointment? And the question is, if I'm sick today, can you see me today? Or what would happen if I call you and I'm sick and feel like I need to be seen today? Will you be able to accommodate me, or am I going to have to wait 2 weeks? Because that's important, because you want to be seen when you're sick. We also want to see patients when they're not sick so we can manage their problems, but we know that they're going to get sick with things that need to be seen right away. And so that's another real good question to ask.
Well, that's some great information, everybody. If you're watching this right now, please pause and rewind and write these things down, especially if you're looking for a doctor that you can trust. Obviously, Dr. Rodrigo Cantu is here to help us with these questions, and we really, really appreciate it. Dr. Cantu, walk me through, if somebody is watching right now and they say, I really like that Dr. Cantu, I want to sit down with him. Can you walk us through kind of the experience that patient would go through when they meet you?
Yeah, so the first time I meet a patient, after they do their registration and come back and I sit with them in the office is I'll typically, after I introduce myself, I'll ask them what kind of medical conditions they have. So I'll ask them, what are the diseases that we're treating right now? And I'll kind of go through and make a list of those problems. The second thing I do always is review their medication list. So I usually ask, and our staff always ask patients to bring their medicines with them
that's good.
To all of their appointments. That way we can go through bottles, we can look at pills, and make sure that we're all on the same page as far as what medicines they're on. So I review that, and that usually I do very thoroughly, especially at the first visit. And then I do a comprehensive history. So I'll ask about their surgeries. I'll ask about any other history things like, are they a smoker? Did they used to be a smoker and now they've quit? So I'll go through those types of things, ask about some family history, because that always kind of brings up some of their risk factors for other diseases. And then we'll, especially at the first visit, I'll usually do a more detailed exam, again, just to make sure that we're getting a good listen to the heart and the lungs. We check musculature. We check neurologic exams. So that first visit is usually just a little more detailed and in-depth, just so I can really get to know that person from that first visit. And then at the end of the visit, what we do is we'll lay out our plan for what we're going to do for each of the problems. And then we'll make a plan for when I'm going to see them next. So that way there's the expectation of what to do, the expectation of what changes they should see until I see them next, and then also the expectation of when I want to see you back, so we can make sure that you're doing well.
Yeah, and that's great, because sometimes when you meet with doctors, they don't explain this, right? They just, well, okay, what is your condition and what is this? And it's like some of our customers, our seniors out there, just feel like they're a number. And especially at this age and time where you have all these changes going on, that's the last thing you want to feel. So I think if you're watching, like I said, it's so important to communicate with your primary care doctor, because we can't read minds, right? I can't read your mind as your insurance agent. You can't read their minds as a primary care doctor. So it's very important to communicate. And maybe you had a doctor that you had to tell this to before, but it's so good to give this information, because we're trying to look at the well-being of your whole health situation, not just one part. So thank you for explaining that so clearly and simple for them to understand.
Yeah, and that's another important thing is, while we're at that visit, and even all the visits, is we try to communicate in plain language, because that's the only way people will understand. And the other thing, and I probably do this a little too much, but I always ask, do you have any questions, especially at the end of the visit? Is there any questions? Is there anything that we didn't cover today? Just to make sure that we've addressed all of the issues, because the last thing we want is to have gone through a long visit. I feel like I've done a lot of things for this person, and then I didn't take care of the real reason that they came in. And a lot of times that real reason is kind of buried in there. Sometimes people don't want to just sort of come out with it right at the beginning. So just giving that opportunity to say, hey, is there something specific that you want to make sure we talk about today? That's real important.
And making the exam room feel like a comfortable place to be in is so important, because sometimes, me personally, when I go to the doctor, I get so nervous, and I've been in this in health insurance for 15 years, so it's like I've been in the doctor's office, but even still till this day, I get sitting on that exam bed, but making it comfortable for the seniors, that's what we're trying to do. And you answering their question helps out a lot, because there's probably somebody sitting there watching and saying, gosh, this answered my questions. This is exactly what I was looking for. So with that being said, Dr. Cantu, if there's a senior that is dealing with an issue right now, or maybe they're not happy with their doctor, or maybe they haven't even established a doctor, and they just want to simply take the first step in establishing care with a primary care doctor, are you currently able to help these individuals right now?
Yes, I'm accepting new patients at the Health Texas in Leon Valley.
Okay.
And like I said, I've been in San Antonio for over 20 years, and so I have a lot of experience in taking care of seniors. So yeah, if there's anybody out there who's watching this that wants to or is looking for a new doctor, absolutely, please give our office a call.
We really appreciate that. There's so many people that need the care out there. If you're watching right now and you were able to meet Dr. Cantu, please let us know if you have questions. We're willing to get you in contact with Dr. Cantu so that way we can make the introduction and help you establish care that you need. Again, thank you so much for joining in, and we'll see you on the next video.
Thank you.